All right, did you know this? Every other minute, a woman in America dies from heart disease. That is a staggering statistic, one that medical experts try to educate us all on, especially women, during the upcoming American Heart Month in February. Well, here with us today is Dr. Kardie Tobb with Cone Health Medical Group, Heart Care. So we're going to talk about all this. Let's start here, talk about the prevalence of heart disease and why it should be such a priority for all of us to take care of our hearts. So let's talk about the prevalence of that.
So Tanya, thank you for having me. I'm excited to be here. But the prevalence of heart disease, we'll start with statistics from the CDC. Last year, the CDC put out data that's showing that at least one person every 30 seconds will die from cardiovascular disease, heart disease. When you look at the country as a whole, 1 in 7 people die from heart disease. And if you come to North Carolina, heart disease is the leading cause of death in our state. And looking at it, when you look at the statistics for females, heart disease is the #1 killer for women, generally in the United States, as well as in North Carolina. So that's very devastating.
Okay, and that's scary to me. All right, so let's talk about how we prevent some of the strategies that we can talk about how to keep that from happening. So let's go down. I'm guessing it starts with a healthy diet.
So the good news is, even though the numbers are high, where 1 in 7, #1 killer for women, but 80% of that is preventable. So yes, we can go down. There's a few things that you can do. Some things are just basic. #1, eating a healthy diet. Picking whole foods, picking fruits and vegetables over looking at refined fats, picking whole lean meats like chicken over red meat. Exercising is a big deal. Taking time out of your day to exercise during the day, getting a good night's sleep. As easy as it sounds, but getting a good night's sleep really helps with preventing, heart disease, as well as knowing your numbers. What is your blood pressure? Do you have diabetes? What's that number? Do you have high cholesterol? Knowing all those things really help you to prevent 80% of heart disease.
All right, and then we've got a graphic up there, and I had all those things, and the last thing on that list was stop smoking.
Yes, I'm glad you brought that up because that was the next point I was going to make. Stopping smoking, or if you don't smoke, don't start, is really important because it increases your risk when you smoke for heart disease. And that includes vaping, that includes e-cigarettes. So cutting back or stopping smoking completely really does help with you cutting back your risk on heart disease.
All right, so what age should we start thinking about heart health and making these steps a priority? I think when you think of heart disease and you think of men and women, you're thinking like people that are like much older than you, but I'm guessing that we should probably start thinking about it a lot earlier than what people think.
So heart disease affects men and women, and it's everybody's business. It's a whole family business. So there's no age to start thinking about heart disease. Start now. Involve the children in the family. Pick diets that are healthier, because think about it. If you start a healthy habit at a younger age, you're more likely to continue that habit and you become a healthier adult and you're decreasing your risk of heart disease. So make it a family issue. Work together, exercise together, pick healthier diets. So encourage your children when they pick foods from the cafeteria. Teach them what the menu shows and what those healthier meals are. And it really makes a difference, those little steps.
Right, so it's not like you can eat whatever you want up until age 30 and then all of a sudden you got to cut that off and start thinking about the heart health. You got to start thinking about that from day one.
You have to start thinking about it from day one. And we have to start encouraging our children's food age, because by the time they go away to college and by the time they're adults, and if they started at a young age, that risk goes down, and as we talk about, 80% is what we do, what the habits that we develop. So. All
right, well, let's talk about family history. How important is it knowing your family history regarding heart health? And I mean, you can't change your family history. So what do you do with that information?
So this is the time for families to talk about what's prevalent or what's happening with heart disease in a family. So you want to understand, is there high cholesterol in your parents, your siblings, if anybody has been diagnosed with high blood pressure. You also want to understand how young, diabetes in the family. And when it comes to heart attacks and a risk for heart attacks, family history is also important, because if your dad developed heart attack at age 55, we call that premature, so you want to make sure to understand and screen for those things, because we're able to screen, we're able to advise and give you information that can really help you when you have that family history. And I forgot to say, mom, age of less than 65, you want to also be on that guard, making sure that your chances are lessening.
Okay, so we want to talk about cholesterol, we want to talk about diabetes, we want to talk about high blood pressure.
Yes, ma'am.
Okay, good to know. All right, we're going to take a quick break. We're going to be right back. We're going to learn a little bit more, and we're going to give you a way for you to be kind of like face-to-face, get some more of your questions answered about heart health, and that's coming up locally here in Greensboro. We'll be right back. Welcome back. Dr. Kardie Tobb with Cone Health Medical Group Heart Care is here. She's answering our heart health questions. All right, so earlier you mentioned that heart disease is the #1 killer of women. So are there certain things that increase a woman's risk that we need to be aware of?
So yes, we do have what we call traditional risk factors, what we already talked about with the high blood pressure, diabetes, the cholesterol, the smoking. But there are now non-traditional risk factors that we have to consider in women, especially women of childbearing age who conceive and have the baby. So these things are when you have hypertension in pregnancy that transiently or just completely resolve by the time you have the baby, diabetes, or you have a baby that is small birth weight. It has been connected now to heart disease in women. So we are very vigilant with that, trying to make sure that women are aware. Secondly, women who have endocrinology dysfunction, something called polycystic ovarian syndrome or PCOS, also increases that risk because it causes diabetes along the line. People who, and then women who've had menopause either prematurely or maturely. But the biggest thing is women of childbearing age. It has not been very known about this information that their blood pressure high in pregnancy causes that. So it really is a factor we have to be considering now for heart disease in women, yes.
Okay. Are there signs and symptoms that are different in women that perhaps attribute to something else?
So we have traditionally added chest pain to the list of when you're having high blood, like if you're experiencing heart attack or something like that. But that traditionally is not what a woman may experience. Women's symptoms are very, very different, where you may just be tired. You know, you're not having that typical chest pain that they're telling you the elephant sitting on your chest is going to your jaw. No, it just may, you may be tired, you may just be short of breath. So symptoms in women that have risk factors or not should really be important to go ahead and see a doctor or call someone and investigate what's going on, because that just may be your symptom and everyone's different.
So what are the signs that we should call 911 like now?
Clearly, the typical signs we are talking about with the chest pain, feel like elephant sitting on your chest is tight, you're short of breath when this is happening, it's going to your jaw. But if you know what your normal is, meaning that you know how you are every day, and you're feeling outside of that, and you just feel you're getting tired and it just doesn't stop, you're getting worse, you're getting short of breath, and you feel dizzy, my advice would be call 911. Be assessed. It's better to have you assessed than not, and be able to say you need to go to the hospital or you need to go to your primary doctor, and make sure you're taking care of that and staying home, because you never know how the symptoms could progress.
Yeah, I think a lot of people say, oh, it'll go away, or let me see how I feel in the morning.
That's one of the biggest problems that I face sometimes with my patients, and I tell them, I say, please call us early, because sometimes you think it's going to go away. Unfortunately, people have lost their lives over that. You want to make sure that if you're feeling not yourself and outside of your baseline or your normal, just make sure you call somebody, call your primary doctor, call 911, because it's really important. People have lost their life and you don't want to be a victim of that.
Right. All right. We've got about 1 minute. Let's talk about what's happening on Friday. There's a symposium that women should know about. They need to register. Tell us what we need to do.
It's so important. You know, 1 in 3 women are going to die from a heart disease. We just talked about that, the #1 killer of women. So we are actually excited here at Cone Health because we'll be hosting our 2nd annual Women's Heart Symposium. It's a free event. There's a link to register, mostly virtual. We're going to send that link, share with you so you can share with the viewers. We're going to be educating women about their risk for heart disease, that female-specific risk factor, what hypertension, high blood pressure is doing to you, what diabetes, what steps you can take to prevent those. So it's going to be a good educational event.
I have a real quick question. Do you have to be there from 9 to 4, or can you just drop in throughout that symposium day?
So ideally, the in-person is from 9 to 1, 1 to 3 is what we're doing our screening session, but you can register and be on virtually. So it depends on the person, and we have an agenda where they can be able to see what benefits, and you get more out of it when you're there all day.
Yeah, I get that. Okay. All right. So Dr. Tobb, thank you so much for that information. We're going to put this online for you, including that link that's to that symposium. All you have to do is look in the To Your Well-Being section.